Good evening. It's Saturday, June 27th. It's 6:15 p.m. and the worldometer says reset. It's time for another daily update. I was going to talk about LA County much later, but the situation's gotten so bad I'm going to talk about it now. So let's dive into it. For today's totals, for a weekend, it's a very high. They are very high numbers, which is unusual because worldometers has always had low numbers on the weekends, and for Saturday they were significantly higher than ever before. So there's no breaks on this ride. USA with 43,000 daily new cases at the top. Highest deaths was Brazil, 994. If we look at, let's see, the USA, go state by state. Highest was Florida with 9,585. The highest we've seen yet out of any state in the USA as of right now. They broke another record, second day in a row, and they're still trying to reopen. There's a cover up going on. We'll touch upon that later. Texas is 6,000. My own state's 4,000. Got a truck going by. See, we got. So we'll cover that, and then we'll get to today's news. All right, so we got a lot to go through, and this is all within the past. This is all from today, so a lot is going on. So we got Richard Garay says he was the first in his family from South Los Angeles to come down with COVID-19 symptoms last month, after which 27, now 28, others in the family tested positive for the virus. It went from running nose to headache to full-blown fever, he said. Around the same time, his 60-year-old father, Vidal Garay, also got sick. It was painful to watch my dad's health decline so drastically in front of me, Richard Garay said. My father is my best friend. Both of them had tested positive for the virus when Richard Garay's condition worsened. I looked at my father and told my father, Dad, I don't think I'm going to make it, he said. Unfortunately, those were my last words to my father. And that's the last thing my father saw of me. Garay eventually recovered, but his father passed away a day before Father's Day. That's brutal. That's very brutal. I don't want my father's death to be in vain, he said. I want people to understand coronavirus is a real thing. So we're seeing a lot of articles of people that did not take it seriously, and now they're crying, they're looking for pity, and they're saying, I should have listened. Well, you should have listened. All you had to do was listen. Oakland McDonald's location to remain closed until workers, public no longer at risk of COVID-19. The article kind of worded that weird. A judge has ruled that a McDonald's restaurant in Oakland must remain closed after the workers and family members were infected with the novel coronavirus. 35 people have been infected, including a 10-month-old child, according to Rubin. The lawsuit alleges that the management and owners of the restaurant discouraged employees from taking sick leave when they had COVID-19 symptoms and did not ensure safe working conditions. The restaurant also failed to inform coworkers when their colleagues tested positive, according to the lawsuit. Now, there's a lot of companies getting involved in these kind of lawsuits for these same reasons. Workers were told to come in even when they were not feeling well, because supervisors said they didn't have enough workers to run the store, according to Rubin. So it's not just McDonald's. A lot of companies are doing things, even churches are doing things like this, where they encourage you to go when you're sick, and the blood of Jesus is not going to protect you as much as you think. A nursing home in Maryland is facing a $70,000 fine for not properly isolating newly admitted residents during 2 weeks in May to prevent the spread of the coronavirus. State health regulators fined Pleasant View Nursing Home in Mount Airy, where the virus infected 126 residents and staff members and caused 29 deaths, the Baltimore Sun reported Friday. The nursing home in Carroll County in April was the site of the state's first major outbreak at nursing homes. The report on the nursing home also states the facility did not have adequate staffing levels and failed to notify officials of the departure of its director of nursing. So we know that nursing homes are getting hit very hard, and they're still getting hit very hard. There's no end to this. The DOH reports death of an elderly Honolulu man from COVID-19. The Hawaii Department of Health Friday reported the death of an elderly Honolulu man from COVID-19, the first virus-related death in the state since May 3rd. A total of 18 residents have died from the virus since March. This is the worst way to emphasize the need for all of us to continue safe practices such as physical distancing, wearing of masks, and hand washing, said Governor David Ige. We must protect our kupuna and others who are at high risk by practicing personal responsibility, especially around others outside our own immediate family or household. In a press release, Department of Health Director Bruce Anderson suggested that many residents are becoming lax in their practices and attitudes towards the infection. In a recent DOH survey, the number of people who considered the virus as a very serious health concern fell from 73% to 54% in less than 2 months. More alarming, according to the survey, are changing attitudes and preventive behaviors. 42% of survey respondents said they are social distancing all of the time, and that's steady compared to a previous survey. However, the fewer residents are allowing recommendations most of the time or part of the time. As the COVID-19 wave sweeps strongly across the country, including in Tamil Nadu, health experts say the pandemic has triggered panic attacks among those who tested positive for the virus, causing bouts of depression and even driving some to the brink of suicide. According to experts, nervousness, fear of contamination, panic attacks, constant reassurance seeking behavior, sleep disturbance, excessive worry, feelings of helplessness, and probability of an economic slowdown are major factors leading to depression and anxiety among the people. Potential job losses, financial burden, uncertainty about the future, and fears of running out of food and necessities add to the worries. Online platforms, too, have seen a growing number of people seeking help for mental health issues, ranging from anxiety to loneliness to concerns over the productivity and job loss since the outbreak of COVID-19. Psychiatrists feel that further worsening situations could lead to severe mental health issues, even triggering suicidal tendencies. Tamil Nadu, one of the worst affected states with a virus count in excess of 74,000 as of Friday, has witnessed few instances of suicides allegedly related to COVID-19. Hari Singh, owner of popular Iruru Kadai Halwa shop in Tirunelveli, allegedly died by committing suicide on Thursday after being tested for COVID-19. Earlier in May, 2 COVID-19 patients in their 50s allegedly committed suicide in separate instances. At the government hospitals they were admitted to for treatment. Again, it's not just what the virus does to your body, it's what it does to your mind. In Mexico, mariachi industry reduced its work in 80%. NGOs are giving them 200 food boxes only. They only perform in funerals now. What a grim turn of events for the mariachis in Mexico. COVID-19 patient discharged from Warren County Hospital after 75-day stay. Again, we don't know the likelihood of the virus killing you, the likelihood that you would survive, or the likelihood that you'd be in the hospital, or the likelihood of how long you'd be in the hospital. So, would you want to be careless, and take a chance and see where you get, or take precaution? So we had a person that was in there for 75 days. Prillis, a coronavirus patient, was discharged Tuesday from St. Luke's Hospital in Phillipsburg after a 75-day stay, including 54 days on a ventilator, St. Luke said in a news release. In addition to those conditions and contracting the coronavirus, Prillis also developed kidney failure while he was in the hospital, which required dialysis. Plus, due to being on a ventilator for so long, he had to have a tracheostomy, according to St. Luke's. He received just about every intervention you could think of to treat the COVID-19 infection, including plasma donation, said his physician, Dr. Eugene Decker. 75 days. We had a guy that was in the hospital, I think over a month, and his bill was $1 million. I remember he was saying something along the lines of that when he saw the bill, he almost had a second heart attack. So I can't imagine the bill this guy's going to walk out with. Oh, this one I think I'm going to get to at the end. It's a summary of a lot of things. All right, so recent news. Florida records new daily high with nearly 10,000 cases. We just covered that when we went to worldometers. Alcohol consumption suspended at Florida bars due to widespread non-compliance amid coronavirus spike. I think Texas also joined that, if I'm not mistaken. And Arizona is like on its way. That's the way it's going. Several South Florida hospitals report less than 7% of ICU beds available. There are states that are reaching capacity. Texas is already turning patients away. We've seen this in Florida. There's other things I'll get to later. But it gets worse when it comes to Florida because of this. Tweak in Florida's ICU bed reporting called data manipulation. The wording was changed from current numbers of COVID plus patients admitted into ICU beds to current number of COVID plus patients currently receiving ICU level of care. Florida has been caught multiple times lying and manipulating their numbers, more so than any other state in the U.S. since the beginning. So I knew they were going to become very bad eventually. And it's coming out why. Maryland reopened protester that organized the protest sticking with COVID-19. Walters declined an interview request from either newspaper, which reported that he said he would not provide any information to public officials trying to trace the spread of the disease. So we saw the anti-lockdown protests, and inevitably, obviously, eventually, they're now getting infected, and they don't even want to cooperate with the officials. The surge continues. Utah reports 578 new COVID-19 cases Saturday, with 1 new death. St. George ICU nearing capacity. We're hearing that a lot from different states. ICU is nearing capacity or already over capacity like it is in Texas. Residents are asked to self-quarantine after about 85 people who visited a Michigan bar get COVID-19. There are likely more people infected with COVID-19 not yet identified. The bar followed safety guidelines for employees, capacity guidelines, and table spacing, the statement said. So people are going to these restaurants. The restaurants are supposedly following the guidelines. And we got one bar/restaurant, one, that got 85 positive cases from it. And they suspect that there are still more to be identified. Can you imagine the nightmare to contact trace this outbreak? Going to a bar during a pandemic, I would question your intelligence to do something like that right now. Chicago Skyguard Sydney Colson tests positive for COVID-19. This is a prominent basketball player. It's a woman. Speaking on a video call during the 2020 WNBA draft, Dawson said the virus hit home as her entire family contracted COVID-19. So we're seeing a pattern here. We are seeing that people who are not being careful are not only getting infected, but it's gone to the point where we're seeing entire families getting infected. And it could mean anything, really. But it's just telling you the situation is getting very bad. This happened in Wuhan. Kids were left orphaned in Wuhan because all their older guardians in their families died. Exclusive. Now, this is something that I found digging through the papers today, and nobody is talking about this. Exclusive. Nearly 600 and counting U.S. health workers have died of COVID-19. 600 in the U.S. have died. Where is the media? Where is the mass media reporting this? This came from a local paper. And it was buried at the end of the archives of what I was searching for. Unbelievable. Kansas. Increase in COVID-19 cases related to attendance at Wild Horse Saloon. So in Kansas, there's a giant stadium saloon type thing where they do performances in bars, and guess what happened? A huge outbreak. All right, more recent news. Canada. Officials said that there are, and again, this applies to every country. So listen to this. Canada. Officials said there are 30,000 patients whose surgeries were postponed or not scheduled at all after the province put restrictions on non-urgent surgeries in mid-March. It could take up to 2 years and at least $250 million in extra funding to address the extensive backlog of elective surgeries postponed in BC since the peak of its pandemic, the provincial government announced Thursday. Thousands of people all over the world are going to die indirectly from the virus because they were not able to get their surgeries because they're prioritizing COVID patients over anybody else. And those that are allowing both regular patients and COVID at the same time are getting overwhelmed and sending people to other cities because they can't help them or turning them away. Bangladesh the government of Bangladesh is planning to charge for COVID-19 tests. Coronavirus suspects will not be able to test their samples for free anymore at state-run facilities as the health ministry is planning to introduce fees. How can a government say they don't have the money for this? This is the happening of all of our lives. And you're telling me you can't cut some funding from at least the police or at least the military or things that just are not that important? For something as important as this? My guess is that they're trying to do this to discourage people to get tested so that they can report lower numbers to justify a reopening, to boosting the economy because they don't care about the people. South Africa. 775 schools hit by COVID-19. 1,169 teachers, 523 students infected. Nobody's talking about Africa. Nobody cares about Africa. And yet we have giant happenings like this happening. And nobody wants to talk about it. COVID-19 cases increase as testing falls in Wisconsin. Now look at this. You got government officials saying, oh, yeah, obviously we have more cases because we're doing more testing. And no, that's not the case. That's not the case to the point where we now have cases increasing where there is less testing being done, Wisconsin being one of them. And it's really hard to trace how many tests countries and states or cities are doing daily because you got to dig through archives to get the numbers or the tallies. Florida, this is recent, this is breaking in a way. Florida, 141 Duval County inmates test positive for COVID-19. Reported cases nearly double. Of those cases, 70 were reported in a span of 24 hours. So not only is Florida getting blasted by cases, now there's outbreaks, really bad outbreaks in the county jails. And these are just beginning. This just happened, so you know it's going to get spread farther than that. COVID-19 victim post haunting warning on Facebook days before death. El Paso, Texas. One Texas family is in mourning after the sudden death of a family member from California who contracted COVID-19 at a party. Of all things. In California, and now must wait 2 weeks to conduct funeral services. Tommy Macias, 51, attended a party about 2 weeks ago and began to show symptoms a week later. He posted an impassioned message on Facebook lamenting on previously ignoring social distancing and mask-wearing recommendations and expressed guilt for exposing his family. Here it is again. I didn't care about COVID. I didn't think it existed because it didn't happen to me, and I don't know anybody that it's happened to, so it must not exist. And then they say, oh, don't do what I did. Oh, I regret. No, you don't get my pity. Because of my stupidity, well put, I put my mom and sisters and my family's health in jeopardy. This has been a very painful experience, he wrote. Hopefully, with God's help, I'll be able to survive this. Macias was dead less than 2 days later. Like I just said earlier, the blood of Jesus is not going to protect you from this, as much as you would like. 14 more members of the family got infected also. Again, we're seeing family outbreaks now. Not just one person gets isolated. We're seeing one person gives it to a bunch of their family members. Additional recent news. New York Governor Andrew Cuomo has directed the State Department of Health to investigate the potential COVID-19 exposure at a high school graduation ceremony in Westchester County. An official press release said a person who had recently traveled to Florida and attended the Horace Greeley High School ceremony began showing symptoms from COVID-19 and then tested positive. Officials say 4 more individuals in attendance have since tested positive for the coronavirus. Here in LA, we also had our graduations, but I don't know how they went about. But we had like lines of like 10 cars covered in black and yellow balloons, honking and driving through the neighborhood, celebrating the graduation of their kids. Did they have a ceremony? I don't know. Most likely, I don't think we're gonna be done hearing about these kind of stories. And this one was very strange, and it's coming out of Stanford University, one of those high prestigious, highly thought of universities. They said Stanford professor says rising COVID-19 cases is proof that virus is tracking human behavior. So he's implying it's like a sentient virus. He says the virus would be very happy if we all went back and started socializing, Dr. Siegel said. So that was a very peculiar article that I saw, and it was around the end of the archives I was digging through. Panic buying returns. H-E-B limits toilet paper towels as COVID-19 cases rise in San Antonio, Texas. The city has seen a significant uptick in COVID-19 cases and hospitalizations over the course of the last 2 weeks. Bexar County has 8,857 cases to date, and the death toll resides at 105. Panic buying is back. You know. A library in Michigan has had to ask its patrons to stop microwaving books in an apparent effort to kill COVID-19. There are a lot of really bad ideas that are not true spreading about the virus. And one of them has to do with microwaving things. So that was just hilarious. It's just peak clown. It's just ridiculous that things like that are happening. I don't think it's here, but there was also a case where in Mexico, 4 people were drinking hand sanitizer, and three of them died, and 1 of them went blind. So you see what happens when you don't want to do research, when it troubles you too much to think, to try to do your own personal investigative research. And now this one's funny. Let's go back 1 week. Pence tries to declare coronavirus is over as Trump pushes reopening and campaigning. 1 week later, new U.S. coronavirus cases break record. Pence cancels campaign events at Arizona, Florida. The comedy writes itself. The comedy writes itself. So this is my situation. Okay, so we'll go back to the other case, the other story I wanted to say, because it summarizes a lot of what's going on right now. Let me just go back and find it. And we're almost done. Just 2 more things left and we're done. All right, so let's see. Oh no, I write it down. Okay, so here we go. This was said by a doctor in a very obscure local paper that I dug through, because I dig through I dig through the archives, I dig through the archives. I dig extensively, and I do this for free. I lost my job. I have nothing to do all day. I'm running off my savings, so I take as much time as I can to research this, to keep people informed, because they have to know this. And let's see. So this is what the doctor said. And everything is sourced, and I'll put the link in the description. I got the source archives. Everything I say is sourced. I'm not making anything up. Everything is tracked down to a source. I source all my work. Maybe the death rate is only 4%, but what is the quality of life of those left behind? The longer this pandemic persists, the more we learn about the consequences of surviving. This virus has proven the potential to produce long-standing issues with hypercoagulability, leading to the delayed emboli, neuralgias, renal dysfunction, pulmonary compromise, cardiac issues, permanent smell and taste loss. Now, I heard about the loss, but I never heard that it was permanent. So that's a new one for me. Memory loss, anxiety, panic attacks, and episodes of sudden death long after recovery. Even those who don't suffer these more severe sequelae describe themselves as seemingly living in a fog, as if with a perpetual hangover. And one of my friends was telling me, saying, that's how I described it, a perpetual hangover. And I was like, wow. This doesn't even consider the horror of going through the infection in the first place, an experience described with the following quotes in a recent New York Times article. Patients have said, it's like the feeling of an anvil on my chest, like I went 10 rounds with Mike Tyson, like having a body taken over by aliens, one organ at a time. It seemed like new fires were starting everywhere, would keep relapsing just as I'd be feeling better. You never know when the virus is going to take you next, etc. This goes on for 2 to 8 weeks. Only 36 countries are seeing declining or stable numbers, compared to 81 with increasing numbers. This is especially interesting as we were originally told the virus wouldn't do so well during the summer heat. The heat is not going to save you. You can't even kill the virus by boiling it. You got to boil it at a certain temperature for a certain amount of time. Regarding Oregon, we are hitting daily records of coronavirus cases. There is an Episcopal church in Union County that boasts over 236 members with the virus. Most of those dying are the elderly, and if you infect an older relative because of your immediate need for a margarita, was that a selfish choice? Also consider the 600 healthcare workers who died because of this pandemic. Those people had families and lives they expected to live out. When they died because of something we just wanted to do, was that a selfish choice? I'm hoping most of us would say that it was. Now that's where I first heard about the 600 healthcare workers. And this article was hard to find. It was dug deep in the local papers. And for the last thing, we'll do an update here where I live. I did a quick drive around the neighborhood. The park is now empty. A couple of weeks ago, they were packed. I drove by, it was empty. Skate parks closed. Not a single body in the park. It shocked me because it was just packed last time that I checked. The grocery store down the block was full, and there were a lot more homeless hanging around the grocery stores than I had ever seen before. And this is a result of the 40 million. Well, now it could be at 50 million or even more. But this is the result of all the jobs that have been lost from the virus. And I saw one man with a sign. He had a mask on, shades on, hat on, said, we'll do any kind of work for money. Saw an older white lady standing by a CVS asking everybody coming in for money. I saw an old homeless man sitting behind the house, kind of spaced out, looking into the distance. It's sad. And I know who the homeless are. Because we have homeless that are kind of famous in my city. And all I saw were new homeless. These are all people that I'm sure just became homeless, have nowhere to go, are desperate, willing to do anything for money. It was a sad sight. So, here's the update. Here's my report for LA, right here where I live. Los Angeles coronavirus update. Model predicts county may run out of ICU bed. Oh, sorry. I kind of went ahead of myself. Okay. Here in LA County, just reported. Los Angeles County showing increases in COVID-19 cases, hospitalizations, and positivity rates. Residents urged to take caution. Again, they never told us that before. Before, the reports were more lax. Like, okay, here, knew this, knew that. Sorry for the family loss. But now they're saying to take urgent caution because the situation is intensifying. 23 new deaths and 2,169 new cases of confirmed COVID-19 in Los Angeles County. There are 1,698 people currently hospitalized. This is higher than the 1,350 to 1,450 daily hospitalizations seen in recent weeks. More. Los Angeles coronavirus update. Model predicts county may run out of ICU beds in 2 to 4 weeks as transmission rate is confirmed to be rising. This was reported a week ago, by the way. I don't know how I missed it, but this is a week-old article, and it's way worse now. Newsom also said Friday, said the virus is spreading so rapidly in Imperial County. Remember when I talked about Imperial County? I called out Imperial County because people that work there, a lot of them come from Mexico, across the border, because it's right by the border. So the pandemic in Mexico is hardest hit city. They're bringing it into Imperial County, and the conditions that they work in are just horrible. And I have been talking about this. So Imperial County, so it says Newsom also said Friday, said the virus is spreading so rapidly in Imperial County that the state has asked that county to reinstate a strict stay-at-home order because the hospital system in the area can't handle the surge in cases. This is a warning of what's to come in the rest of California. Riverside County's Emergency Management Department director told the Board of Supervisors on Tuesday that 10 to 15 patients a day are being transferred from neighboring Imperial County to Riverside County and surrounding jurisdictions. He said then that fewer than a dozen of those patients were receiving care in medical facilities within Riverside County, but the figure as of Friday was unavailable. On Monday, Newsom said Riverside is one of 11. One of 11 the state is watching due to coronavirus surges, along with Imperial, San Bernardino, Los Angeles, Santa Barbara, Kern, Fresno, Kings, Tulare, Stanislaus, and San Joaquin counties. According to the California Department of Public Health, in addition to outbreaks in state prisons, a higher number of COVID-19 cases in skilled nursing facilities and recent public protests involving large numbers of people who are pushing rates up. So we're seeing, what I've noticed as of yesterday is that we're seeing that it's the protests that are finally coming up as part of the cause for the increase. So that's the update. It's getting bad. It's getting worse. Brace yourselves. I said a long time ago, June was the month, and June is the month. And as we get into July, I can't imagine the chaos that we're going to see. That's today's update. Stay tuned for tomorrow's update. Thank you for watching, and I want to thank those of you who have spread the video, those of you who have commented, shared the video. I didn't really think much of the first video, the red pill one, but it got around. At least a few people were watching it, but that's good enough for me as long as I can spread the word around. I'll see you tomorrow.